As always, I'm happy to welcome back to the program our 0 Hour senior correspondent and so much more, Sonali Kolhatkar, whose work can be found at risingupwithsonali.com. And she has a new piece out on, I still can't believe I say these words in reference to Robert F. Kennedy Jr., our Secretary of Health and Human Services for the United States of America. So, first of all, Sonali, welcome back to the program.
Thank you so much, Richard. Always a pleasure to be with you.
And you. Not a pleasure to talk about this topic, though. And again, it's your working headline. The headline that I've seen for this piece is, I think, right on the money. In a way, almost says it all, which is that Robert Kennedy Jr.'s anti vax stance threatens to undo a century of medical progress. And having lived through much of that century, it's striking to consider it that way. But to tell us about
Yes, so we all know that Robert F. Kennedy came into this position as somebody who was skeptical of vaccines. He's been building up a following for years. Trying to draw this link between vaccines and autism, which a lot of sort of people on the fringes have tried to make, and over again, scientific research has proven this to be a completely false link. So when he came in as Trump's health secretary in January, it was top of mind for senators who were supposed to confirm him. There are Republicans, believe it or not, who also have science backgrounds and believe in science-based medicine. And one of them is chair of the very important Committee on Science. It's a longer name, Senate Committee on Science and some other things. And he's a physician, or was a physician at one point, who is Senator Cassidy. And he is somebody who was asked about, are you going to actually confirm an anti-vaxxer to be health secretary? And he hemmed and hawed and he wasn't sure. And he was like, I'm really skeptical. But he ended up confirming him in January and said that he extracted promises from RFK that he would not impact vaccine recommendations in the United States. Now, Cassidy is experiencing or is worried about a challenge from the right in his state of Louisiana. And so he chose politics over the vaccines that are life-saving to Americans. And what did RFK do? As soon as he got into office, within a few months, of course, he started questioning vaccines. He's been questioning the COVID vaccine. And so we had a Senate testimony by RFK just a few weeks ago in early September. And it was like anybody with half a brain cell could see that RFK had no idea what he was talking about, because he kept saying that Trump deserved the Nobel Peace Prize for Operation Warp Speed during his first term, when he oversaw the record-breaking development of the COVID-19 vaccine, and then kept making claims that the vaccine didn't work. He contradicted himself. He was all over the place. He's a master of deflection. And then soon after that hearing, he handpicked a number of people on this very important, influential federal advisory committee called ACIP, Advisory Committee on Immunization Practices. He had not named people to this committee. He was supposed to. He had held off. Then he finally named a bunch of people after the Senate confirmation hearing, and has now basically not taken a position on certain combination vaccines, called in to completely change the COVID-19 vaccine protocol, saying that people would have to check with their doctor to see if they were eligible, on and on and on. And he has confirmed everything that people were concerned about when it came to vaccines and vaccinations and his position on it, to the point where he has the president of the United States now making wild claims about pain medication, such as acetaminophen. So we have the ultimate science conspiracist at our top of a public health federal agency. And it is terrifying, because vaccines have saved countless lives in the last century. And maybe precisely because it's worked so well, we don't think about the fact that children are dropping dead of polio around us like they used to. There was some ridiculous global child mortality rate that was, in the double digits, and we don't have that anymore.
Well, absolutely. And that's part of what I was reflecting on reading your piece. First of all, just you use this word once, you don't use it in your piece, but I always challenge this one word. The Bobby Kennedys of this world are not vaccine skeptics any
No.
more than I'm a fascism skeptic, right? I'm not skeptical, I don't question its efficacy. I'm against it. Similarly, Bobby Kennedy is as you write in your piece, is an anti-vaxxer fanatic. Really, he's an anti-vaxxer, and to me, a fanatic. And one way that, and the politicization of it is astonishing because, as I mentioned to you a few minutes ago, I had my annual physical today, and even here in liberal, in a liberal county, I don't want it to be that easy to find me, but in liberal Montgomery County, Maryland, even here, my doctor had to say in making her recommendations, how do you feel about vaccines? Are you for, she was clearly, she'd been burned a few times. She's treading on what she thought was dangerous, rightly was dangerous. Are you for them? Are you against them? Are you neutral? And I said, well, I'm for science. Let's start there, right? I'm unequivocally pro science and the scientific method. And but to me, she didn't say to me, are you for anticholinergic nasal inhalation therapy, or are you against it? I don't know. I haven't read the research. I'm not trained to read the research, but this has become such a political issue. And the other thing I was reflecting on was, I remember when I was a child and the polio vaccine was rolled out. And the fact is, my eldest brother developed symptoms of polio before we got the vaccine. Then my other brother and I started to run fevers. And, my parents had to look at the possibility of losing all three children. And then it was a miracle. We had to line up. We got pricked with these things with the different, like 8 needles on them or something. But this was one of the great scientific breakthroughs of the time. And like insulin, the scientists who invented it didn't try to get rich off it either.
Right,
So,
right.
to me, the idea that this could be politicized as a
Yeah.
matter of civil liberties is
And and
surreal,
what
right?
blows my mind is that the anti-vaxxers want to claim that it is a matter of civil liberties because they want to boil it down to individual choice. The problem is vaccines work based on something called herd immunity. It isn't the kind of thing that it's a personal choice. It's not about like, do you want to eat gluten or not? It's not anything like that. Vaccines work best when as many people as possible are vaccinated, and the fewer the percent, the lower the percentage of any population being vaccinated, the more in danger everybody is. Those who are vaccinated are slightly in less danger, not slightly, maybe quite a bit more in less danger, but still they face the more they're surrounded by unvaccinated people who have the chance of spreading a disease, the more often they get exposed to the disease, the more likely it is that they will catch the disease even if they're vaccinated, because every vaccine has a 90 to whatever 95%. It might have, I'm just throwing out a number, if it has a 90 to 95% rate of protection, that means out of every 100 times you get exposed, 5 times you might catch it. And so if you but if you aren't exposed, if you're only exposed 10 times because almost everyone's vaccinated, you're not going to catch the disease. But if you're exposed 100 times because the people around you aren't vaccinated, it's likely that you could catch it. So herd immunity. And there are very small numbers of people who cannot get vaccinated, very small infants because they're too young, and certain people who are legitimately allergic to certain vaccine chemicals. And they rely on maximum
Right.
vaccination around them to keep themselves safe. So it can't be, it is an act of collective care. And I go back to this over and over again every time I analyze our politics today, is that our hyper-individualist capitalist politics is going to be the undoing of our country.
100%.
Everything is about just individual actions. And it's not.
It's 100%. Yeah, that's exactly where your piece led me. You use a great phrase, Sonali. You said it's an act of collective care to vaccinate, and this anti-community politics that's reflected in somebody like Robert Kennedy and somebody like Donald Trump is nihil. It's almost, I don't know the word, nihilistic or something. It's just an attack on communal civilization to think that all that matters here are your individual rights. Now, people will point out, and it's true, that there is a tiny but not zero possibility you'll have an adverse reaction from taking the vaccine. This is classic risk management. Frankly, I think the Biden administration blundered in not being more forthcoming about that, because then any single incident could be used to discredit the entire movement. But what I want to say to people who advocate this politics is that there's probably a greater statistical chance that you'll get in a car accident while you're driving to the polling place to cast your vote. So you better stay home that day, just for your own personal protection. Obviously, I'm being sarcastic, but it's gotten to the point where if you wear a mask in public, people tell me that they get sneered at or abused, abuse directed at them for protecting themselves and others.
Yeah, and in fact, often mask wearing, like in East Asian cultures where mask wearing was much more common even before and has been more common before the COVID-19 pandemic, often the people wearing masks would be the one who might realize they have to go to work, but they have a scratchy throat that morning. And so just in case they've been infected with a virus, they would wear a mask before getting on the train to protect other people from their germs, just in case, right? It is a way of saying I care about the people around me,
right,
to protect them from me. And when everybody takes that position, your whole community is protected. And I think that we've really lost that, especially more and more now as we get into these hateful right-wing political times where the very definition of being an American equates to you look out for yourself. You can apply a similar logic between vaccines and guns, right? It's not a matter of, oh, fine, if you don't like guns, don't get guns, but everybody should have the more surrounded every single one of us is with guns, the more likely we are to be killed, whether we own guns or not. Our kids going to school in communities, counties, and cities which are awash in guns, and it just increases the likelihood that we're going to get killed in the crossfire. So surrounding ourselves with gun-free households is the only way to remain physically safe from gun violence. So it's a very similar thing. It's like removing guns from our communities is an act of collective care. But no, we are told by the extremist, individualist, hyper-individualist capitalists that it's their God-given right to own a gun, it's their God-given right to not be vaccinated, it's their God-given right to basically have us all, the rest of us, live in perpetual danger so that they can have their God-given rights that are basically a death wish. These are all death-wishing ideas to own guns, to issue vaccines. Why not uplift life?
Well, sure, but again, I'm always to the point. I find it clear that Bobby Kennedy is a pernicious force in the public discourse on this issue. So is Donald Trump. And, they're moral cowards like Bill Cassidy, who knew damn well, in my assessment, precisely what Robert Kennedy would do. And, he did take the Hippocratic Oath at one point in his life. And, all of that. But, I'm also relentlessly self-critical, as I think you are in certain ways, as a movement member, of what can our movement do better? Not necessarily what did we do wrong, but what can we do better? And to me, part of what's happened here, and it's nobody's fault among the population, among the general public, but it's become, I think, another, in a lot of people's minds, anti-vaxxer public, elites versus regular people, right? And there was an element, I think, a little bit of a tone of talking down, of hush teachers talking, as opposed to, I mean, my idea, the late Dr. Paul Farmer liked it, which I was immensely pleased with, was have MAGA voters who got COVID go out and talk about how bad COVID is, rather than having Harvard educated epidemiologists talk about it, because people are just politically right now, people recoil at that. But whatever it is, I mean, I kind of think we on the left have to kind of put our heads together and think about, how do we communicate? Because I don't want anybody to die. I don't want anybody to die because they're turned down by.
I think there's a serious problem there in the left inadvertently embracing individualism when it comes to things like health and wellness as well. I think there's and we've paved the way. There's far too many people on the left who think of if I'm going to become, save the planet, become vegan, one act. Yoga and mindfulness is, that whole wellness mindset of protect yourself by going for these kinds of sometimes unproven weird health things that sometimes have some basis in reality and health and sometimes don't, and focusing on that to such an extent that has also fed into this idea of there's a lot of people among Christian nationalist movements who are eating clean and worried about they're keeping their bodies pure. They're thinking about health from a purely individual perspective, when they're much more likely to, have success if they think about living in communities where there are no food deserts, when they'd be much more likely, you are as healthy as the community that surrounds you. And we keep, even the left falls for this. And so I think even the left needs to really think about how we talk about health when we get all up in our, excitement about mindfulness and wellness as an individual action. And it really, really shouldn't be that way. So, and the other thing is, I think you're right. We've also got to remind ourselves that there are certain things that, RFK was able to slip into people's minds by saying a few things that made sense.
Right.
The pharmaceutical companies are out to get you. They're trying to make a buck out of medications. And, no wonder people buy that. But of course, we forget to emphasize that it's not just pharmaceutical companies being pharmaceutical companies. It's big business being big business.
And it's politically corrupt politicians being politically corrupt politicians. Yeah, the other thing I thought about reading your piece, Sonali, was when I was in South Africa during the horrific AIDS crisis there, meeting with people in the villages and elsewhere in the remote communities, trying to get the local HIV infected women whose husbands would bring it back from their work in the cities and in the mines and so on to take medication, because probably at least 1 million people died because they mistrusted pharmaceuticals and used folk cures instead. Well, their mistrust was grounded in reality. They had decades, if not more, of lies and exploitation by the American and European pharmaceutical corporations, food corporations, Nestle's, you name it.
And you have a similar aspect of that among Black communities here in the US, among Latino communities here in the US that have had things like forced sterilization. Absolutely legitimate, and those need to be addressed. And people were talking about that during the COVID-19 pandemic, I remember.
And the only other thing I wanted to add, yes, exactly. And the only other thing I wanted to add was I loved what you said about collective health, and it's not an individual solution. That also applies to the health of the climate, and therefore the health of each of us. We've come off of 50 years of propaganda that says only you can save the environment, right? The crying so-called Indian that was really an Italian actor from Brooklyn. Exactly. My Uncle Jerry, I always say, played Chief Yellow Cloud on Rin Tin Tin. So we're guilty of that appropriation too in my family. But the idea that it's individual responsibility as opposed to, yes, it's great to recycle. I'm all for it. But as opposed to, no, you've got to vote out the bastards that allow the pillaging of the planet and the destruction of our ecosystem.
Absolutely. I'm here near Altadena, and the coming upon the 9 months after the horrific Eaton fires, the conversations are about how can we rebuild by hardening our homes to fire. Again, individual solution. Yes, of course, every individual would think that way naturally. How can we stop the next fire? Can we talk about that? And there's a lot of emphasis about suing the insurance companies and Edison. Okay, what about suing the fossil fuel companies whose emissions are responsible for the extreme weather that how are we going to stop the next fire? No one wants to talk about that. They want to talk about how they as individuals are going to survive the next fire. So it's as if it's inevitable that there will be fires. And of course, if we don't do something about climate change and fossil fuel companies, there will be fires. So yes, agreed. All of that. It's like everything. The only answer to our individual survival is our collective survival, right? And we got to remind ourselves of that over and over again. And vaccines and the climate, all of that's, involved in that.
Yes, I won't quote Smokey the Bear. Only you can prevent forest fires. No, I'm the bottom of the chain here. There's PG&E, there's everybody else. Well, on that note, unfortunately, Sonali will have to end. But again, Sonali Kolhatkar, senior correspondent for the Zero Hour, and so much more. You can find her at risingupwithsonali.com. Sonali, thanks for writing this piece, and as always, good to speak with you.
I'll see you next week. Thank you so much, Richard.
We depend on your support here at the Zero Hour, so please give whatever you can at any of the links you see on your screen. Thanks so much.